Hi there, this is Jenny, Dr. Peters, and I am going to try to explain to you the anion gap. So I've had some students ask me for better understanding of the anion gap and what that really means in the body. Also, I had a student ask a great question of why isn't the anion gap, why do we have an anion gap anyways? Like, shouldn't it be zero? How come we have one? The gap means there's something abnormal, right? Well, I want to try to explain that, why there is a normal range for an anion gap. So let's go back to, though, over here. This here is a blood vessel right here. And as you can see, I drew, which I'm not a good artist, so I drew some cells and some electrolytes. So remember, there's a balance. So that's called the blood buffer system. So your body's always trying to maintain a proper balance between your sodium, potassium, your bicarb, your chloride, there's phosphorus, there's magnesium. Remember, there's like all different types of electrolytes. And it's trying to maintain an even normal electrolyte balance between the sodium, potassium, etc. That's just BCl. So if that's off balance, then your body's not going to be in balance, and it affects everything from your respirations to your entire metabolic process in your body. So I don't want to go into too many details. I want to try to make it simple. So first we saw this, okay? Remember, the blood buffer system is really important. And also know that we have a normal pH, okay? 7.35 to 7.45. All right, and if it's down, and how are you going to measure this? You're going to draw an arterial blood gas, because that's where you can measure what the acid or what your pH is in your blood by an arterial blood gas, ABGs it's called. That's not really done on regular, like say med-surg floors unless something's wrong. It's usually done in the emergency room or critical care or step-down unit perhaps. There's a reason why you want to draw ABGs. Do you feel like they have, shortness of breath, difficulty breathing, severe COPD or emphysema, pulmonary embolism, shock, trauma, etc.? You're going to draw ABGs, diabetic ketoacidosis. Okay, so that's that. So let's go over here to the anion gap. When I think of an anion gap, I think of it as, is the balance correct between your cations and your anions? All right, so your cations are positive and your anions are negative. So positives are sodium and potassium, and your anions are your bicarb and your chloride. When you think of an anion gap, think of it as a calculation. So I think of it as just math, basically. Because what you're doing is, the lab does it for you, but you can do it yourself, is you're taking your sodium plus your potassium. So you're going to add those together, and you're going to get a number, all right? And then you're going to take your bicarb plus your chloride. Remember, that's a negative. You're going to add those two together, and that's going to give you a number. Then you're going to take this number here. I'm going to say this number. Let's just say it's 13. Let's just say we came up with that. No, it can't be that. Hold on. It's a bad number because your sodium wouldn't be like that. That wouldn't be good. All right, let's just do a number. To equal, so you can do number minus your number, and that's going to give you your result here. All right, so that's how you do it. So if you get a complete metabolic panel, you should be able to do this calculation to get your anion gap. Normal anion gap can vary from lab to lab. Let's just say it's 3 to 11 is most labs. Sometimes it's 3 to 10, but 3 to 11. All right, so if you get one of 10, an answer of 10, then you know it's a normal anion gap. Well, why is there a gap? Well, because look at this over here. Oops, why did that do that? Oops. These other anions are not accounted in the equation. And they're not just anions, they're other types of electrolytes. These are not included in this equation. So you're going to have an abnormal, or what we think could be an abnormal gap, because we're not accounting for all the other electrolytes that are in the bloodstream. So when you think of anion gap, think of it as just like a marker calculation to try to warn you if you suspect somebody is in acidosis. Most commonly, you're going to see an elevated anion. So let's say we have it as 15. This person comes in and you're like, that anion gap is pretty high. What are you going to suspect? You're going to suspect an acidosis. So most likely that pH is low because these are off balance. Why? So is your body making too much acid? Is your body not making enough of this bicarbonate? It could be. It's hard to say why, but the most common, you have to look at the patient history. The most common acidosis is going to be your ketoacidosis. And what is ketoacidosis? It's ketones. So usually if somebody is diabetic and comes in with a super high blood sugar, 800, 900, I've even seen higher, they are producing too many ketones that are spilling in your bloodstream. And so you become acidotic and your body's not able to keep up with all that acid and get rid of it because your blood sugar is abnormal. So your body compensates for it and you start breathing heavier because remember, your whole system becomes off balance. So your body's trying to kind of compensate. Your body, is a well-oiled machine. And so it's saying, hey, something's wrong. Let's try to blow some of these ketones out, so you start increasing your respirations. So the most common is your diabetic ketoacidosis. Okay, most common. Other ones are, and those are keto acids, but you can also have lactic acidosis. Now, you're not going to see it as much, but if you work in a trauma center, you might, because shock can cause lactic acidosis. Overdose of aspirin can also cause lactic acidosis. There's other types of acidosis, but I'm not going to go into those. I just want you to understand you're going to most commonly see your diabetic ketoacidosis and lactic acidosis. And understand how we got that anion gap and why do we have a gap in the first place? Because we're not accounting for these other electrolytes here in the equation, because it's just wanting to give us a good idea of whether we think someone's acidotic or not. So if someone has diabetic ketoacidosis, there's a common term we use in ICU stands or whatever, is to close the gap. So you want to close the gap up, meaning you want this to go back to normal the way it should. So what are you going to do? Well, you have to treat the underlying cause. So if someone's ketoacidotic, there's too much acid, so you're going to give them some bicarb. So right here, I have a little IV pole, and that's going right into the vein. All right, because you want that to balance out. In the meantime, you're giving them insulin. You're trying to get that blood sugar down as well as move some of those electrolytes, balancing in and out of the cell like it should. So that's why the blood buffer system is the quickest way to change somebody's electrolytes, because it's going right into the bloodstream. All right. So understand also what a normal pH is. Understand your diabetic ketoacidosis. Understand that this is really important. Another thing I'd like you to try to understand too is when here is normal serum osmolality. So we want it normal osmolality. What is the biggest indicator, or let's just say what's the most important electrolyte? Or what do we have the most of? Well, we're going to have sodium. So sodium is really big. So if sodium's off, then your chloride's going to be off. Your potassium can go off. Water gets your water content, which makes up a large percentage of your body, works with the sodium, your sodium and water. So if you're retaining sodium, you're going to retain water because the sodium's just going to suck all that water in. So think about people getting swelling in their legs. You don't have to know that stuff, but I think if you try to understand what's going on in the bloodstream, how you're getting these results. Anion gap you're getting from someone's going to order a complete metabolic panel, and these results are going to be on there. And usually an anion gap's on there, but sometimes it's not, and you can do the calculation yourself. And I think that's it. All right, so we have I explained the anion gap, the positive versus the negative. This is the bloodstream. You have to treat that. If you have any questions, I want you to email me, and then I can try to explain it further for you, okay? And that's it.